Alright, hello, my name is Kristen Freeman and these are my colleagues Mackenzie Martin and Brooklyn Marion. Today we're going to talk about anorexia nervosa and the impact it has on teenagers mentally. Anorexia nervosa is a potentially fatal eating disorder where one adopts unhealthy eating habits along with extreme methods to losing weight or to avoid gaining weight. These are two examples of what would be going through your mind as someone suffering with anorexia nervosa. There are two types of anorexia nervosa. There is restrictive, in which a person is controlling their weight by limiting their intake of food. The other type is binge eating, where a person will eat, but they will expel their food after eating by vomiting or the use of laxatives. As teenagers' bodies have not fully developed, this is extremely harmful and has a heavy impact on their full growth potential in the future. Some symptoms. Many teens that suffer from anorexia nervosa tend to have more obsessive compulsive personality traits, which is also a fancy way of saying they probably have OCD as well. They're going to often strive to be a perfectionist, pay close attention to detail, and have a need for control when relating to others. This also leads them to hold themselves accountable to the idea of perfection. This distrust causes them to have significant disruptions in their life. With the feeling of needing to be perfect, along with the extreme body dissatisfaction that they suffer, most teens face contributes to their anorexia, and also it contributes to the two most commonly seen mental health diagnoses associated with anorexia nervosa, which are anxiety and depression. As a teen, a surrounding peer or someone that might just be close with someone suffering from anorexia, you might witness them not focusing in school or participating in social events like going out to the football games, the soccer games, the baseball games with their friends, or not even wanting to go out with their friends and get coffee. They're going to exclude themselves. And you might notice them having a higher irritability than they might have when you met them when you were younger, rigid thinking, and low self-esteem, which leads to a higher risk of suicide.
This graph shows the different groups of people and the self-harm and suicide rates within. So this light gray is non-suicidal self-injury, and the darker gray is suicidal ideation, which means like they're harming themselves. And then their suicide attempt is black. And so transgender people with eating disorders, about 122 of them, 70 to 75% of them are all about self-injury, and then they did 436 of these transgender people, and it only went to about 20 or 30. And then females, they did 12,278, and their attempts were between 20 and 30%, but they also did females without eating disorders, and it was 200, and 21,101, and they were about 10%. And then the males, they did with an eating disorder, it was 4,915, and it was about 40%. And then males without an eating disorder, they interviewed 121 and 387,000, and they were about 10%. Through outside influences like social media, it distorts teenagers' brains. They showed the wrong definition of true beauty, and they struggle with body dysmorphia and self-worth. With the lack of eating, it causes malnutrition. Malnutrition is when you don't consume enough nutrients and your body begins to shut down. In this case, severe malnutrition causes the heart, brain, kidneys, liver, and endocrine systems to shut down. The extreme risk for suicide is detrimental for teenagers. The severe body dysfunction and plummet of self-worth is all hard to recover from. With all of these developmental issues, it's hard for teenagers to recover, and it leads to adulthood. School psychologists would allow students to openly talk about their problems. They could accommodate their educational needs and they can implement plans to better eating. Some students don't feel open enough to talk about their problems to their adults in their home. Providing programs for trusted adults would increase the awareness of anorexia nervosa. Then every student and child could get widespread support to being healthier and better nutrition. Having classes about eating disorders for students would allow students who aren't open enough to talk about it at home to realize it themselves and get help on their own.
However, there are some limitations to our solutions. Some teens may not feel comfortable openly speaking about things like their eating disorder, and they may not want to admit that they have a problem. This may be because in the past people have made them feel like this was something to be ashamed of and that they have to keep it a secret. So they might be less likely to go speak to a therapist or to a counselor, and this would make it difficult for any sort of therapy to be effective. Another limitation would be that some parents don't believe that their child has an issue, and they may not believe that mental health is an issue at all. Because of this, they may not participate in the programs, and they might not want to learn about what is going on. Parents need to be a part of their child's healing process, and by not allowing their child to get the help they need, and by not being willing to learn about what is going on with anorexia nervosa and any sort of mental health that their child is dealing with, their child would have a difficulty in healing. And our other limitation, funding is limited in school systems. School systems may not be able to afford the extra help they would get from these therapists and from the counselors, and they also wouldn't likely be able to afford the proper setup for these programs. And in the top corner there, you can see a picture that kind of depicts what is going on in the mind of someone with an eating disorder, specifically in our case, anorexia nervosa. You can see a tape measure. This is used when seamstresses are measuring you for your clothes. That's often how people with anorexia view themselves. They're often measuring their waist and their wrist and just anything that has fat on it they are measuring. And that's why it's wrapped around an apple which has been eaten. The apple is healthy, but it's still food which can add on to your weight. And that's how people with anorexia nervosa often view themselves. And here you can see a chart that kind of summarizes why anorexia nervosa is an issue. It goes over the two types of anorexia nervosa, being restrictive and the binge/purge. Restrictive being the type where you are eating less or not eating altogether, and binge being the type where you're eating a lot of food in one sitting and then expelling that food by vomiting or by the use of diuretics. It also says a few of the different types of treatment that can be used, which we did kind of mention earlier in our solutions, but specific names to these would be individual therapy, family therapy, there's rehab, the programs, or there's behavior modification. There's a lot of options for different type of people because people deal with things differently, and so there's a lot of options for them to go to in their healing process. It also says some of the physical symptoms. We did talk about mental symptoms, but some physical symptoms would just be low body weight, a fear of weight gain, an obsession with food, exercise, and weight itself, an absence of menstruation, losing or thinning of hair, and growth of lanugo, which is kind of a peach fuzz that covers your body with the absence of nutrition. And on the bottom here, you can see some statistics that are involved with anorexia nervosa. Here it says that 20% of anorexia nervosa cases will attempt suicide within their lifetime. And in the middle, it says that 10% of individuals with anorexia nervosa will die within the 10 years of the onset of the disorder. And 90% of anorexia nervosa cases are female. In conclusion, anorexia nervosa is an issue, and it does have a huge impact on a student's mental health. Although our solutions do have their limitations, we believe that our solutions can help someone who is suffering with anorexia nervosa. And that's all we have. Thank you.
All right. All right, Kristen. Reflecting on your colleagues' work, which one had the greatest impact on your overall understanding of the problem that your group identified?
Mackenzie's paper was from a scientific lens, so that really formed our whole presentation and our whole problem because she researched what it was, what it's doing to your body, how it's going to affect you in a school environment, in a home environment. So her paper really just sealed the deal on everything that we had put together.
All right. Mackenzie, if you had another team member, what other perspectives or limitations could they have researched that would have made a useful contribution to the project?
If we had another team member, I think we could have really focused in more on the health aspect and what it's really doing to your body. Although I did scientific, it was more on statistics and stuff like that. But if we were to do health, we could really go in depth on how malnutrition really affects your body.
All right, Brooklyn. Give one specific way that your thinking changed as a result of learning about Kristen's findings.
So Kristen used the social lens, and me, when thinking about anorexia as a whole, I always thought about it as something that was mainly physical. I knew that it did have its mental effects on your mental health, but I had always viewed it as your physical health. You're lowering your blood pressure, you're losing weight, you're losing your hair, like all of the physical aspects of anorexia. And by reading Kristen's paper and learning that it can change your social behaviors and that you may become more introverted, where at one time you were more extroverted, and you might stop hanging out with friends and just participating in activities. I hadn't realized that before, and by reading Kristen's paper on the social aspect, my thinking changed in that way.
All right, thank you guys.